Hospice may be the best way to end a life. Find out why next on Age-Wise. Hello, I'm Ed Rosenberg and welcome to Age-Wise. A family has to face some difficult choices when a loved one's life is ending. Hospice is one of the options. On this Age-Wise program, we're going to find out more about hospice. I'm joined by Cassandra Curley, a registered nurse and Director of Professional Services in Watauga County, Carol Smith, also an RN and administrator in Avery County, and Colleen Gentry, who has firsthand experience with hospice care. Welcome to the show to all of you.
Thank you.
You know, the singers Waylon Jennings, Bobby Bare, Mel Tillis, and Jerry Reed got together one time in a studio, called themselves the Old Dogs, and recorded an album of songs on aging. One of those songs says that no matter what we do to try to stay young and look young, you're still going to die. And given that we're all going to die, isn't it best to do that with dignity, in comfort, surrounded by our family and other compassionate people? That's what hospice, I think, is all about. But Cassandra, let's start with you and tell us what hospice is.
Okay. Hospice, in my eyes, is really a holistic approach, like you said, to provide dignity and comfort in someone's last days or months. Typically, the hospice criteria is to, for a physician, an attending physician with our hospice physician, to make them meet the criteria for hospice, which is a terminal diagnosis, one that cannot be cured. Maybe they've elected to not do any further treatments. So our job is, with our team, to provide comfort and dignity to those that are ultimately going to pass.
And Carol, how did you become interested in hospice and become a hospice director?
My grandmother died, and she did not have hospice services because I come from a family of nurses, and we elected that. And I just, going through the experience with her and not having support except from our family, really got me interested in what we could do, what hospice did, and how they support the family. And so I've been in hospice for 10 years, have worked in multiple hospice jobs, and came back to Avery County from the hospice house in Asheville, where I worked, and came to Avery County and came back to work here. And I've been the director for a year and a half. So it's a calling. It is a calling.
Well, Colleen, you've used hospice services. Tell us your story. What happened, and how did you connect with these people, and how things turned out?
My mother was in assisted living here in Boone, and she was 98 years old, and she had decided that she did not want to have any life-extending procedures done at that point. She felt like her life was complete and she was ready to transition. And she suffered a heart attack, and we knew, based on the conversations with the physicians, that she probably only had 2 or 3 months to live. You know, her heart just wasn't going to manage for much longer. And so the assisted living facility that my mother was in coordinated to bring in hospice care, and Cassandra was actually the nurse who provided hospice care for my mother. And what was really great about the experience was she not only kind of coordinated care in terms of helping my mother be comfortable and looked after by the assisted living facility, but hospice also provides a lot of support to the family around what's normal, what to expect, how to think about things. So it was a really positive experience. And Cassandra worked with my mother and our family for about 2 months until she passed, just a week short of her 99th birthday. So,
What was different with hospice being engaged versus what might have happened if you hadn't accessed hospice?
Well, I think I'd preface this by saying that my mother was very, very clear about the kind of care she wanted, and no extending efforts, to help her stay alive. If we didn't have hospice in place, I think my sister and I would have made decisions that probably weren't in line with exactly what she wanted. For example, things like antibiotics or other things that technically might help her feel better, but actually were going to extend her life. And so while Cassandra didn't tell us what to do, she helped kind of be a translator from my mother to us about what she wanted and what she didn't. So she helped us stay objective and also allow the family to really focus on just being in support of her and not having to, try to figure out all the things that needed to be done. Hospice brought in doctors, special care, all kinds of additional pieces that left to our own devices would have been incredibly stressful to deal with at a time when we knew that Mom wasn't going to live for very long.
So one thing that I hear you saying is that the hospice client has a lot more autonomy in directing the care that she's going to receive than might happen if someone is just in a
Yes.
hospital.
Yeah.
So it seems that rather than trying to cure someone, instead hospice is caring for someone. Cassandra, is that correct? Can you talk about that?
It is. Yeah, we give our clients and patients the opportunity to make their own decisions along with their family. And like Colleen said, at that point, the family can step back and actually be a family instead of a caregiver. So we take on more of that caregiver role to give them advice, to guide them along to know what best decisions would ultimately be the best for the patient and their wishes too. So they're able to, like Colleen said, with antibiotics, it may not be that, necessarily it's going to cure anything, but it will provide them comfort at the end of life.
And it seems that, unlike in a hospital where perhaps the patient interacts only with doctors and nurses, in hospice there's a very diverse team of people who coordinate care along multiple dimensions. Carol, can you tell us, basically who's on the team?
Yes, we have nurses who are case managers, of course. We have medical social workers who are the support, help navigate different resources, avenues. We have nurses aides that, of course, go out and provide personal care for the patients, and we have a chaplain, and we also have volunteers that help. Our volunteers are a big part of our team. They sit with the patients. They try to do what the patients, hobbies that the patients have done. They read to them, sing with them, things that the patient really enjoys. So that gives the family a break a little bit also if the patient is at home. So the volunteers are there, but the team works together with their medical director also as the oversight. Not all of these services, some patients choose not to have a chaplain or a volunteer or a social worker, so that's just fine. They get to choose who's on their team. That's the important part.
One thing I'd add too that you kind of alluded to, Carol, is you said if they're at home, and I think one of the things that's really great about the way that hospice care is provided through MediHome medical and hospice care is you have an option of staying where you are, wherever that is. So in my mother's case, it was assisted living. She was able to stay there. Hospice came to her. Hospice will come to your home. And I think for me and our family, we had this paradigm that if you went to hospice, you had to go somewhere. You had to go to some building somewhere else. And the beauty of this is that it allows the client, my mother in this case, to decide what it is that she wanted and what was the least stressful and the most compassionate step. So for some families, they might want to bring someone home from the hospital, but in other scenarios, you can stay where you are. So it's just really nice to have that choice.
So hospice is not going to tell you where you have to be. You can
Right.
be almost anywhere.
And you can also have hospice in the hospital. That's a myth that we try to dispel. If a patient is in the hospital and they're at the end of life and Hospice can come in as a support system there, work with the doctors and nurses there to manage symptoms, and be supportive to the families also. So the places you can have it assisted living, home. You can also have it in nursing homes and at the hospital. Group homes, pretty much anywhere where you are.
Well, I think you said that to be eligible for hospice, you have to acknowledge a terminal diagnosis, life expectancy probably less than 6 months. This has to be certified by a physician. Let's say that someone is okay with all that, and now their question is, how much does this cost? How do we pay for this? Let's say I have an elderly parent who is dying and is willing to have hospice care. How do we pay for this, Cassandra?
That's always a big question. Hospice does not turn down anyone. So even if you have no insurance, if you have no money whatsoever, we're open to care for anyone. They do elect a Medicare benefit, which so everything is billed through Medicare and it is reimbursed through the program. So we certainly take care of anyone. We've cared for people at the hospitality house before who actually don't have a home or anything. So we turn down absolutely no one.
So it can be sliding scale, it can be Medicare.
Right.
Will pay for part of hospice services. How about Medicaid?
Medicaid as well, and then private insurances also.
Okay. And Carol, you were going to add something?
Private insurance.
It looked like, okay. But if someone is destitute and qualifies for hospice services, those services will be provided
Most definitely.
as well. So cost is really not
No.
a factor here. Well, what about the different levels of care? And Colleen, let's address this to you. As your mother went through her last stages, did her care needs change, and how did hospice react to that?
Yeah, well, they did, because she was dying. And so, there were, through the course of the couple of months, there was deterioration. So initially with hospice, my mother was conscious. She was able to have conversations and that sort of thing. As her health deteriorated, she stayed in place, in her room, in assisted living, but the levels of care, like the level of intensity, the kinds of medications to keep her comfortable, supporting things like breathing apparatus or other things that could keep her comfortable, were brought in. We didn't have to really think about that. Cassandra would call us and say, here's what's happening with your mother, and we're going to bring in blah, blah, blah. And that allowed us to go, oh, great, this is wonderful. So as long as it was directionally correct with what she wanted, what my mother wanted. And when my mother first started in her engagement with hospice, she was really clear with you, wasn't she, about what she wanted and what she didn't want. So Cassandra really was an advocate for her in this process. So as things got more challenging and more emotionally difficult, the amount of time that Cassandra and other hospice care workers spent with my mom increased. And going back to the other question about cost, so we never got a bill for hospice care. It was all covered. And with my mother, it was heart failure and some other extenuating issues. But again, with hospice, in my mind, it was something that you got if you had cancer or, some kind of big terminal illness. But in this case, it was just helping her to transition during the time that her heart was giving way. So in the end, I think, Cassandra, you were with her like probably 20 hours a day towards the end, or she would be with Mom and then she'd leave to do a few other things and come back. Whenever I came to see Mom, Cassandra was there. So there was always somebody who, Mom was never alone. It was really cool. Even though it was in assisted living where you have plenty of other people, there was always somebody with her. So.
Did you know all of this was going to happen when you first contacted hospice, or were there some pleasant surprises, things you didn't think that hospice was going to offer, but they did, and it made everything easier and more comfortable?
So Carol, I'm thinking that maybe you were involved in this, but
so.
There was this, well, first of all, we didn't even know that hospice was an option for moms. So that was something that the assisted living facility helped us become aware of. But then Carol called me several times during that process to check on how we were doing. Did we need any kind of support, like counseling or anything like that? And that continued for months after Mom passed away. I mean, there was a very planned process of staying in touch with us because, grief hits you at different times. And particularly if it's really intense at the end, sometimes there's like this mixed bag of relief and sadness when, a family member dies when they've been really, really sick. And so there was this ongoing support that came from hospice. That was a complete surprise to us. We didn't expect that, but we also didn't have a clue around the extraordinary support that came from the whole experience.
Well, let's talk about what we might call the aftercare program, because there may be this misconception that if someone's receiving hospice services, that when that person dies, the family members get a sweaty handshake or a hug, and then hospice disappears. But Carol, that's not the case, is it? There are things that
No, it's
hospice
not.
does afterwards. What?
Right.
Describe that.
We follow patients' families after the patient passes for 13 months with bereavement services. We have a bereavement coordinator who contacts the family if the family would like visits. We also do mailings at special times during the year at the patient's birthday, anniversary dates, Christmas, to the families. We do, and they also do phone calls. Some families elect that support. It's also optional. Once again, you do not have to be followed for the 13 months. If a family member, even after the 13 months, is still working through the grief process, we continue to follow them.
But typically you do 13 months, and why is that?
That's just a kind of a Medicare rule for the 13 months, but that's not locked in.
Okay, but you do get through all the anniversary dates, the first birthday, or what would have been the person's birthday without that person, the first Christmas, the first Thanksgiving, the first anniversary, and so on. Cassandra?
And the other thing that we started to do a few years ago is yearly we do a memorial service. So for all of the patients that we've lost in the past year, that gives all of the families an opportunity to see the faces that they were so used to seeing. So, we do have the bereavement coordinator, but, not all the time is he really involved in that immediate care. So at the memorial services, we are able to see our families. They're able to see the nurses, the CNAs, social work, chaplain, everybody that they were so used to seeing all the time. So we do that usually in October every year, and we try to get with everybody so we can have that closure.
So hospice provides a diversity of services, some that we might not expect. It can take place anywhere from home to a hospital to a long-term care facility. Cost is no object. Hospice continues to serve the family through a bereavement period. What if someone's in hospice and all of a sudden they say, wait a minute, I don't really believe I'm dying anymore. I don't want this. I mean, are they trapped?
No, not at all. It's an elective service, so at any time they can discontinue our services. And sometimes, with that ongoing continuation of care, they do get better. I mean, the more a nurse is seeing them, the more support they have. Sometimes we do have people that graduate off of hospice, and we can transition them into our home health services if they still need some help. And then we also, if they do elect to discontinue services, if at any point their condition worsens at some time, we can always pick them back up and care for them again. So.
Well, one thing we've discussed is that when someone enters hospice care, the treatment goals change. When you're in a hospital, the goal is to get you well. In hospice, everybody acknowledges that the person is dying, and so the goal is to allow the person to die with clarity, lucidity, relatively pain-free, surrounded by family members, other loved ones. Colleen, even with your mother in a long-term care facility, did you see this shift in how she was being treated? Could you talk about that?
Yeah. Well, I was thinking as you were talking that the comment that you make, Carol, about this work as a calling, and the people who come into this work, I mean, it's just it could be such a painful experience. Instead, they see it as this, it appears to me to be something that's just a way to lovingly care for people through this last transition in their life. With Cassandra, what ended up happening is not only was there increased levels of care, but you just really kind of dug my mother, just as a person. But I think she does that anyway. I think that there's this desire to understand and know the care provider, the person that's being cared for. And so not only were there increasing levels of connectivity, but one of the things that to me was really important about hospice was, as my mother got closer and closer to the end, even if you're comfortable with the knowledge that this is the right thing, you get panicky. You get afraid about the loss. You don't understand what's necessarily happening. And what hospice did, in the person of Cassandra in this case, was helping us to understand this thing is normal. This is something that is a manifestation of an infection or the heart getting weaker. So it helped us understand kind of the outward things that were happening with Mom and how her cognitive abilities were being affected, things like that, that then helped us go, okay, so this is just part of the process, and we can be at peace with knowing that this is just part of the process. The other thing that happened is, and I could see this would probably happen a fair amount, is hospice workers, because of the intensity of the work and the closeness that they have with the patient, there's this connectivity that sustains. So Cassandra and I and my husband have had really interesting conversations about my mother and the last few weeks of her life and things that she talked about with us or with Cassandra that have been really wonderful from a closure perspective. And those have come up over time as we've reconnected to have conversations around that. So, that kind of care is also really super unexpected and really wonderful.
And a few times the word volunteer has cropped up. Carol, to what extent does hospice use volunteers, rely on volunteers? How are volunteers screened and trained?
Volunteers go through the same screening process an employee goes through, and they go through a 12-hour volunteer training also, and we match, the volunteer coordinator works really hard to match the patient with the volunteer, okay? We don't just say, okay, we have a volunteer, we have a patient, here we go. We match those up. And we use them quite a bit. We don't just have patient volunteers. We have volunteers that come to our office and answer our phones or help with mailings, doing that kind of thing. If they don't feel that the patient care is right for them, then we do have the office volunteers. Volunteers are a big part of our program. And it's, the one thing is, the myth with volunteers are, I can't volunteer for hospice, I can't sit with somebody that's dying. Not all our patients are dying right now, okay? We have patients that are on service sometimes for a year or more. Matching the volunteer and getting the volunteers in there earlier with the patient really is just the extra support sometimes the family needs and the patient needs.
So people can volunteer for hospice.
Yes, they can.
Even if they feel a little bit squeamish about being with dying people, there are other things that they can do, and volunteers are very important to hospice, being able to offer the services it offers, especially on a sliding scale, free of charge if necessary. I wanted to ask you about an issue that came up when the Affordable Care Act was being debated, and that was the scare story that there were going to be Medicare death panels and that people would be deciding who lives and who dies. And this almost gets over into another controversial issue, which is physician-assisted suicide. And what I wanted to ask you was, how does hospice feel about physician-assisted suicide, about someone being helped to die before they naturally would? Cassandra, you want to tackle that one?
That hasn't really came up with us a whole lot, only because, our goal is to make sure that someone is comfortable enough to pass. And not all the time does that mean with medication. Sometimes there are spiritual things that are keeping people here. And that's where we utilize our other team members, as far as our chaplain. But as far as suicide, we don't necessarily look at it like that. We more or less look at it as helping them physically to get everything under control to where they can easily pass. And that certainly may mean increasing medication just to, help with the respiratory system, help with their pain, help with the anxiety so that they can easily pass.
And because everyone involved in a hospice situation acknowledges that the person is terminal,
Right.
there's no concern about, are we using addictive medications?
No.
It's not a big deal
Right.
there. Colleen, if you could pass along a message to people who may have a spouse or a family member who is dying, if you were to suggest hospice to them, how would you do that?
Yeah. Letting go of people you love is hard, even if you know it's the right thing to do. Hospice helps you focus on the things that are the most important for you as a family member to focus on, and allows the support of whether it's physical care, pain care, spiritual care, whatever it is, to be handled so that you can be fully present and with those people that are dying in the last weeks, months of their life. So I actually talk about hospice a lot with my friends. Because of my age, many of my friends have parents who are very old and in this kind of scenario. So I talk it up a lot because it's such a wonderful service. There's actually no downside to it because you are in complete control. It's all about the patient, and it allows you to really be there and be loving and supportive to whoever it is that's passing.
So your experience with your mother's death is that it was a better death, and it was an easier death for everyone because of hospice.
It was a way better death, and part of that was because Cassandra, and this would be true I think for any hospice nurse, understands what's normal and helps them also to relax into the process.
Okay, well, I want to thank you, Colleen. I want to thank our other guests, Cassandra and Carol from MediHome Health and Hospice, for being with us today. They say nothing's sure but death and taxes. And we're not talking about taxes on this show, but we do know that we are going to die. There's no reason why not to think about it. And fortunately, there are programs like hospice that can be tremendous help to many people. So thank you all for being on the show today.
Thank you.
That's Age-Wise for this week. If you have questions or comments, you can reach us through our website at watchapptv.com. Until next time, I'm Ed Rosenberg.